Today on the show, John Kruse, MD, PhD. John Kruse, Dr. Kruse, is a neuroscientist and psychiatrist. He's been working and helping adults with ADHD for more than 30 years. Dr. Kruse, welcome to the show.
I'm delighted to be here talking with you today.
All right, I want to jump into this because you've been doing this, like I said, for a while. Um, what was the inspiration or the motivation or the catalyst that got you into not just mental health, but this niche of ADHD?
Good question. So I had finished a PhD in basic neuroscience. It was actually on circadian rhythms and biological clocks. I had done my medical school and I finished a residency program in psychiatry at University of California at San Francisco. And in 4 years of training, and this was considered one of the best departments in the country, there had not been a single mention that adults could have ADHD. And then one of the very first patients that was referred to me was a guy who was 40 years old. He was above average intelligence. He was already on disability when I first met him because he had not held a job for more than 6 weeks, and he had held more than 100 different jobs by the time he was 40. And furthermore, his psychiatrist, who was a Freudian analytic psychiatrist, said, I've been working with him for 7 years. He's a smart guy. He's a nice guy. We've made no progress. Could he have ADHD? And he referred, and I'll call this guy Frank to the university clinic. And they did 3 days of neuropsychological testing. And they said, if you were an 8-year-old boy, you would have ADHD because he's talking nonstop. He walks around, he blurts things out, he gets off track, he has trouble starting things. But that doesn't exist in adults. So here, we'll turf them off to you, the young recent graduate of the program, and you figure out what's going on. So, I mean, there were some elements of depression, there were some elements of substance abuse going on as well, but it was so clear pretty quickly that he had full-blown ADHD symptoms and that was the essence of his inabilities to function well in society. So I had to, and right about that time, there were other researchers and clinicians finally getting a clue that, the dogma was every kid who has ADHD outgrows it by the time they're an adult. And part of why that persisted is how fragmented our healthcare is. That who would the kids see? They'd see either a child psychiatrist or they'd see a pediatrician. And when they turned 18, they didn't see that person anymore. So they're run out into the world. And again, if you're an adult psychiatrist and you don't even think ADHD exists, you don't see it when it's in front of you. So that started changing right about the time I started working with Frank. And what was striking over the next years was how often people who were often trapped in our mental health system for years with depression or anxiety that just wasn't responding had full-blown robust ADHD symptoms that weren't being recognized. So that's what led me to work more and more with that population.
It's interesting to me that it took so long for adult HDAD to be recognized. It just seems like that would be a no-brainer because we know that you don't always outgrow your childhood, whatever diseases or whatever. It's just like
Mhm.
some people outgrow, what do you call it? The asthma, right? The old asthma inhaler. A lot of kids outgrow that, but not everyone outgrows that. And
Mhm.
I even had two friends of mine who, when we were in high school, both of them, all three of us wore glasses. uh, they outgrew both of their glasses. Somehow their eyesight
Right?
became
Mhm.
20/20 without doing anything, and they didn't need their glasses anymore. I wasn't that fortunate, but it just it did that just strike you as odd that it took so long for
Well,
people to recognize this
I
adult
I
version?
haven't ever linked these before, but you just reminded me of something. We have twins they just finished college this fall, but one of them, the first 2 years of her life was a projectile vomiter. This sounds off course, but when her, when my niece and nephew, who are 3 years and 6 years older came and visited, they actually knew how far to stand, like 4.5 feet to be outside of the range. And the doctors never found a cause. It was just, it wasn't, it was most days, at least some. But my husband and I reassured ourselves, it's like, we don't know any 16-year-olds that are doing projectile vomiting like this. She will
Right.
outgrow it. So our, maybe less so in the behavioral mental health realm, but there's a host of childhood conditions that absolutely people outgrow. But the other bigger thing it sort of highlights is that believing is seeing. If you don't believe something exists, you don't see it. You come up with other reasons to explain it, or you don't even notice it, or you don't register it. So that's part of the value of recognizing ADHD as a condition because it helps you make sense of patterns of behavior that otherwise don't make a lot of sense.
Yeah, that to me it's just so interesting that they it took so long to be recognized, and something that you said, which I think something I've never thought about, and that is our health system is so disconnected. As you mentioned, you might have a set of providers when you're in that
Mhm.
what is it,
Yeah.
younger age, you outgrow them, but somehow that I don't know. I don't know if they don't ask for records or they figure, okay, well, you're 18 now, so we're going to start the whole chart stuff over. I don't know, but it does make sense to
Yeah,
me that
I
sometimes
think
those records get lost.
Yeah, I think an adult doctor would look at ADHD, 30 years ago would have seen ADHD and would have treated it like seeing diaper rash on the chart. Okay, they had diaper rash, they outgrew it. So, so getting back to part of how the field became more aware of it was actually through ADHD clinics, where the clinicians at clinics treating kids would notice, hey, wait a minute, I'm also treating kids with bipolar and depression and eating disorders. Their parents are remembering to pick up the medication. Their parents are the ones showing up on time. Their parents are the ones who, you know, don't miss appointments. And it was finally being aware that, wait a minute, a lot of these parents, because there's a strong genetic component, a lot of these parents of kids with ADHD are displaying ADHD symptoms themselves.
Yeah, that's tremendous. All right, so let's talk about this in case somebody is listening or watching and they're going, "This might sound like me," but so what are the symptoms or what are the traits that we should be looking for an adult having ADHD?
So the official mental health classification systems criteria for ADHD consist of 18 symptoms, 9 of which are inattentive symptoms. So missing details and making careless mistakes because of that. Um, Trying to think of, I'm blanking right now.
Well,
Being readily
real quick
distracted.
on the mistake there you're talking about, but you're talking about somebody who's consistently making these simple mistakes, right? It's not like a one-off;
Yeah,
it's a
so consistently,
constant
because
thing.
all of us make mistakes. So part of
Right.
what's difficult about ADHD is that all of the behaviors are within the realm of normal, and it's that they have to be excessive for that person's age and cultural group, and that they have to be interfering in some meaningful way with life function. So there's inattentive symptoms. There's also hyperactive or impulsive symptoms. And with a kid, some of the hyperactivity could really be running around in circles. Most adults, even with bad ADHD, don't run around in circles. But Frank, when he would come in the office, he would often get up and pace around the office. And it wasn't because he was that anxious. It was so some amount of hyperactivity can be there. It can be more subtly fidgeting with fingers, drumming on desktops, shaking your feet, things like that for the hyperactivity. And then the impulsivity can include things like blurting things out spontaneously. So it's the one person when at the group meeting, the boss asks for, did anyone have problems with this? And someone, will blurt out, yeah, this was really stupid because you did this and this, whereas everyone else knows, you know, don't say that to the boss, even if you're thinking that. So it's troubles with impulse control. Um, So our diagnostic criteria are these symptom lists, but increasingly over the last decade plus, we've been thinking about more conceptually that ADHD is a issue of what we call executive functions of the brain. And the executive functions of the brain aren't just your memory storage or your knowledge, but it's how you're handling information. So it's how you're handling attention, and attention isn't just sustaining attention for a long period of time. It's switching it when it's appropriate. It's directing it to what's appropriate in the environment rather than all the extraneous things. Um, Other executive functions have to do with things like time management. They have to do with how you initiate a task, how you organize the task in the sequence of events, how you complete a task. It has to do with working memory or keeping that knowledge that you need for the next 10 seconds before you don't put your lunchbox in the dryer because you're changing clothes out of the washing machine at that time. Um, so we think of ADHD sort of more conceptually as an issue of executive functions, and a couple things that does. One is that so much of the earlier ADHD research and sort of thoughts about it focused on the kids not doing well in school or the young adults or even older adults not doing well in the work environment. So it's sort of productivity oriented. And an important part for at least two-thirds of people with ADHD is poor emotional regulation, which is an executive function, but it also brings up that ADHD has a huge toll on social life. And that starts in, grade school. Again, the kid who's not paying attention and slams into his classmate. I saw this on the playground when I was a chaperone. This was a progressive San Francisco school, and they had just started a program about um, communication and pacifying aggressive conflicts. And this girl who was in a judo class, and she was just on the playground, not paying any attention, doing some judo moves. And another kid, so both these kids were on the ADHD spectrum. First kid kicks the other girl full in the chest, and half the playground rushes over to start this intervention. What were you thinking of? What could have you done as an alternative? And both kids were completely mystified because both kids got it. I wasn't trying to kick, this wasn't anger or aggression. This was, I'm not paying attention to my environment. I'm doing something cool that I like doing. And the other kid was, she's not angry at me. I just walked into the wrong place at the wrong time. So part of that again gets at if you don't understand really what's going on, you're going to come up with horrible solutions for treating it. And I mean, it also highlights hyperactivity can be a part of ADHD in girls as well as boys, because that's a common myth that girls are never hyperactive, they're only inattentive. Um, there's a third point there, and I've just dropped the ball on that third point to that our anecdote was trying to be. But
That's all right. Okay, so I want to talk about this real quick because I think not always, but many times when you know you have ADHD or ADD or there I think there are some hidden gifts. Uh, and so I wanted to ask you this because again, you work with thousands of patients over your lifespan, your career span there. Uh, have you found that sometimes that there's a hidden gift with this ADHD?
it's a loaded question because some experts particularly yet don't like, I mean, there's a part of the ADHD community that boasts of superpowers, and the superpowers they most often associate with it are creativity or sort of thinking outside the box, which overlaps with creativity. It's often high energy and enthusiasm, which can be infectious. If you're really into something, that I call the sort of the eternal freshman syndrome, where it's like, hey guys, look at this. This is really cool. I mean, that not everyone with ADHD is like that, but it's a common trait associated with it. Candor is one. And if you don't want me to go into political situations, I won't, but I'd say there's certain, I mean, in the older eras, if you said something that wasn't true or was a mistake, you had a big penalty for that as a politician. So politicians in general tended to be people who carefully scrutinized and were careful of what they said. And and came across as very scripted and controlled.
Right.
In our more modern era, there's certain prominent people who seem to be have multiple symptoms on the ADHD spectrum, and they just blurt out what's ever at the top of their mind. And they've used that candor. The difficulty or my problem with it is that they are blurring candor with honesty. You can be completely candid and say what you're thinking. Doesn't mean it's right, doesn't mean it's true, it doesn't mean it's accurate. But there's a refreshing quality to that clearly some politicians have used as a big asset. So candor, I mean, has it cost lots of people lots of jobs and others? So candor, many of the ADHD traits are sort of double-edged swords.
Yeah. Yeah, I think that one of the things that I hear a lot is I can multitask, which I think is I know that people love to use that word multitask, but I think it's been proven time and time again that you're not necessarily multitasking. You're doing one thing and then you're stopping for a brief second to do something else, and then you're coming back. And so it's very difficult to really do multiple things at the same time. And so I think that, but again, I know that a lot of people in the uh, ADHD community, they feel as that that's a strong suit for them. And I could see their point, but uh, I think
Yeah,
creativity is definitely good.
the research data on the um, double tasking or multitasking is pretty much along the lines of what you said. I mean, certainly can most of us walk and chew gum at the same time. Both of those are tasks that don't require active attention concentration. But for
Right.
tasks that are requiring active attention and concentration, nobody double tasks. Everyone is switching off, and it might be at a microsecond level, but you're switching back and forth. And virtually every study has shown that's less effective, that's less efficient than doing the two together. And there have been studies of people with ADHD, and they are actually not any better at multitasking in terms of actual accuracy of results or efficiency of producing things. But part of it is that they may be more practiced at it. I mean, they're doing it more of their lives because they're distracted. They may recover better, or they may present to the world better, or they, may be better at signaling, yes, I'm following you when I'm typing on my iPhone under the table, and they're creating the impression because they practice it better that they're following you. But the actual data, and not that in a lab situation we're always capturing everything about real life, but they are not any better in study after study at multitasking.
Yeah, and that's kind of what I've seen as well. I mean, I believe that I probably have some level of ADHD. Some of the symptoms you talked about. My leg is constantly going. If I'm, you know, my leg seldom stops. Yeah. So now I want to kind of talk about. I think now here in 2025, things have gotten a little bit better. I think that we as a society are starting to be a little bit more tolerant about people who act differently or think differently. Uh, but I know for a while there, and I don't know if you still see this in your practice, there was a lot of doubt and shame and just a lot of criticism around ADHD. Do you still find that when you work with people?
Yeah, it's still there, and it's still there. There's even people within the mental health field who just insist it isn't there, or I'd say even more weird or unhelpful is people insisting, and popular authors, that there's no such thing as ADHD. It's all complex trauma. These are all people who've been traumatized, and trauma can cause some of the executive function deficits of making it harder to concentrate, making you more distracted, making you more emotionally volatile. So there's certainly overlap. You can develop a complete ADHD-like picture from trauma, but we know, one, that there's a strong, very strong genetic connection to ADHD. Um, Two, people with no documented history by not just their own recollection, but family members and others can have full, robust ADHD. Three, and this may sound weird too, but trauma in America seems to have actually gone down substantially over the last several decades. And if trauma were causing all of ADHD, ADHD rates have been going up, trauma's been going down. Again, is there still too much serious trauma than there should be? Absolutely. But
Absolutely.
it clearly can't be used to explain all or even most cases of ADHD.
Yeah. I just find it interesting that some people still do not accept ADHD. Like you said, there's some some professionals out there that don't believe it exists. And again, looking at my family, genetically speaking, my parents didn't have any ADHD that I ever saw. My both of my parents were academics, and my dad wrote multiple books. And I bring this up. And my mom was like I said, she was an academic as well, and she taught. And
Mhm.
and those tend to require a certain level of having good attention spans for long periods of
Absolutely.
time. And as far as I know, I was the only kid in my family that had ADD and then ADHD. And so for those who are listening, yeah, you don't have to have a genetic disposition. It just happens, right?
Yeah, I mean, there are some environmental causes which are tightly linked to it. So one that's much less of an issue than it was in the 60s and 70s was lead. So in that era, we had substantial amounts of lead entering people's lungs and bodies from leaded gasoline, particularly. That was the biggest source, but lead paint was another major source. And so in mid 1970s, about the time the EPA tried to pull and started demanding pulling lead out of gasoline, the average lead blood level in kids in the mid 70s was about 15 micrograms per deciliter of blood. I'll just say 15. We have lots and lots of studies showing a good correlate. So right now, the average level is less than one.
Mhm.
And the EPA's guidelines or level of concern is as low as 3.5. So, and there's some experts who say even any lead is some risk, but we can see much higher rates of ADHD as you go from 1 to 15 micrograms. We see other um, intellectual problems as well, but again, lead is one clear environmental factor that and again, everyone who had lead in their blood above a certain level everyone didn't have it, but the rate of developing it was strongly correlated with it. And so environmental exposure, at least to lead, there's certainly reason to think that many of the plastics we're contaminating our world with now also are affecting that prefrontal cortex where the executive function circuitry is stored. So part of it is, and head trauma. The prefrontal cortex, it's there right in front of your forehead. It's vulnerable just because it's head front and center, and it's a big area. And we know that there are some people who develop ADHD symptoms without having previous symptoms as a direct result from head trauma. So,
Interesting, interesting. Let me ask you this, because again, you talked quite a bit about the executive function and our ability to focus and regulate ourselves. And I was wondering, in today's world, where social media is constantly pulling, uh, almost kidnapping our attention, how is that
mhm.
altering our executive functions? Have you noticed anything there?
So Well, I am fairly sure there's a direct cause and effect relationship. Part of what's hard to tease out is a lot of the studies just establish correlations. So what they show is kids and adults who spend way greater number of hours on social media or engaged in it have more distractibility, have greater difficulty sustaining attention, And that's been much of the discussion around it, but there's even, again, these other executive functions like emotional regulation is measurably worse. Impulse control, impulsivity is higher in this population. So what's interesting and getting much less attention is it's a full range of ADHD symptoms that at least are correlated with higher exposure to social media. And it's so part of the difficulty of doing a study is how can you deprive someone of social media for weeks or months? I mean, you can, but then there are a multitude of other factors and life experiences they're missing out on, and it makes it harder to know, is it actually social media? Is it being disconnected from friends? Is it feeling different and deprived? Is it that fear of missing out? Is it um, but there's also sort of shorter terms. I mean, so there's a MIT study that got a lot of attention just a few months back, where they had students writing essays on several occasions, and they either did it completely from their brain, that was called one group. A second group could use Google to look things up or as a resource, and the third group was using AI, large language systems to essentially write their reports for essays for them. And they looked at EEG as measuring brain engagement. And not surprisingly, the group that was most engaged, the group that actually felt most closely ownership of these essays, the group that could remember what they had actually written best was the group who just used their brain. And the group that relied most entirely on AI was worst at all those categories. And there seemed to be so there were acute measurable effects that there they could be pretty clear that it was, again, they weren't segregating out for long-term over the course of your life, how much time you spent. It was just on this specific task. It seemed directly relevant.
Yeah, that's interesting. It's so funny because again, this AI, which you mentioned, large language models, and a lot of people are saying, "Hey, this isn't real AI. This is as close as we can get now. It's as it upgrades, it'll change." Either way, I see it. I see it's going to get to a point where again, communication is going to be hampered because it's going to be, "Hey, John, I'll have my AI contact your AI, and we'll get together for lunch," kind of a thing, right?
Well, I mean, in terms of talking, I've I have friends who are school teachers everywhere from middle school up through college level, and the ones that have been in the field for a while say is so striking is that they'll walk into a classroom, and in your era and my era, growing up, kids are there might be rowdy classrooms, there might be fairly sedate, but kids are talking to each other, kids are
Yes.
interacting, and they
Yes.
will go into a classroom, and there'll be 20 kids if it's an elementary school or 100, and nobody's talking to each other. They're all sitting at their desks, and no one's, they're not throwing spitballs, they're not causing disruptions. They're just not interacting. And, maybe some of them are interacting even with kids in the same room, via text. But it's we are engaged in a vast experiment, which no one's given informed consent to, and we don't know how much this is going to be affecting brains and communication and empathy and all sorts of skills like that. Um, I think there is reasonable reason to be worried.
Oh yeah, absolutely. There's reasonable reason to be worried. I think everybody should be worried. Okay, so let me ask you this. When you're working with your patients, what do you tell your patients who are trying to navigate a world designed to distract them every second, right? So do you tell them to stay away from social media? Do you give them some other kind of advice as far as distractions go? Any thoughts there?
Yes, so I'm a physician, so I can and do prescribe medications, and medications for ADHD, 50 years of research says are the single most potent intervention in terms of reducing symptoms to the greatest extent and likely to help the greatest number percentage of people with ADHD and help reduce symptoms to the greatest extent. On the other hand, one, they're never completely curative. Two, lots of people, for very good reasons, either don't want to take them or can't take them. But again, three, they are never the complete answer. So there's always more that one can do. And the simple message is what's important is making your environment fit your strengths and weaknesses. And part of what deficits in executive function imply is that it's much harder for you to generate the structure and organization that other people may be able to generate themselves. So it's seeking it from external sources. So the two biggest non-medication things that I recommend are having a schedule and a task list and learning how to use those. And that can be, again, particularly challenging for someone with ADHD, but particularly useful. And then two, in terms of the daily living other stuff, it's getting good sleep, because sleep deprivation itself, what part of the brain is it impacting most? It's the prefrontal cortex. It's those same executive functions. Being sleep deprived makes you more distracted, makes you more irritable, makes you more impulsive. It replicates all of the symptoms of ADHD. The good thing is you get a good night's sleep and that's gone. But given that sleep deprivation itself, by most studies and surveys for the last 20, 30 years, 20, 30% of Americans, adult Americans are not getting, adults and adolescents are getting insufficient sleep. So the worry is these are all having cumulative effects on the brain. And again, sort of the prefrontal cortex, which houses, and some of this I'm oversimplifying a little bit, houses the executive functions, is unique in two special ways. So one is most of our brain isn't readily fatigable. We don't even think about this much. You look through your eyes, you might be awake 16 hours today, 17 hours, 18 if it's a long day. Your eyes might be tired, particularly if you're just looking at a screen and staring at a set focal distance. But at the end of the day, colors haven't started to fade. You're not seeing fuzzier edges to things. Your the visual cortex doesn't fatigue. And same with the motor cortex, it sends signals to your muscles. You know, if you've been exercising, the muscles might be tired. They may do less well, but your ability to say, flex this, move my finger here, that doesn't fatigue. So what's unusual is the prefrontal cortex executive function circuits. Most of those are fatigable. If you are told to pay attention and concentrate on this, that's time limited. You start failing the longer it goes on. And emotional regulation too. You may hold it together for the first part of your commencement speech that you're giving to everyone, and then, but you see enough other people in tears or something, you burst out into. So all of our emotional executive function prefrontal circuitry seems to be fatigable, and even more not alarming, but why so many of these symptoms wind going together is that they bleed more into each other than others, than other parts of the brain. So I'm again oversimplifying a little bit, but our visual cortex is at the back of the head. There's auditory processing centers nearby, but people don't start, again, when they're tired or anything else, mixing sound. I mean, there are some people with somatosynesias who are processing information in different senses differently than the norm. But normally, you don't start getting into overlap when one system is getting tired. I mean, you don't start. Whereas in the prefrontal cortex, if you concentrate too hard or too long and you've depleted that system, you're more likely to have trouble controlling your impulses, and you're more likely to have emotional regulation problems, and you're more likely to not being able to switch out your attention when you should need to be able to do that. And you have more trouble estimating time. So all sorts of these executive functions are more likely to wind up being affected together, which is why ADHD, I think, is a helpful unifying concept. But it also means it's a concept that ADHD-like symptoms can show up under a lot of other conditions, including just stress and fatigue.
Yeah, no, absolutely. And I think I'm so happy, I should say. I'm so glad that you brought up the whole sleep thing because not only are we all sleep deprived, but I think to make things worse, there's this massive push by marketing companies to push the energy drinks. And you hear about again somebody who downed two or three different energy drinks, and when I say somebody, I mean a young person, 17, 16, 17, 18. They'll take two or three energy drinks and then they pass out or they're rushed to the hospital or whatever. But it's crazy how much I see caffeine pushed massively. These energy drinks are pushed massively, and and nobody's thinking, or let's say normal sleep is not being promoted as much as these other
Mhm.
these other alternatives. And so we're not getting enough sleep. We're wired on caffeine and other energy products. So it's this vicious circle. And of course, when you're on energy drinks, you have limited attention span, right? You're kind of a
Mhm.
spaz. But it's interesting to me. I just noticed that in media lately, it's just been I shouldn't say lately, I want to say for the last 10 years. It's just you watch a cop drama and the cops are all swigging tons of caffeine, or there was a show not too long ago where um, the good guy was a computer hacker. You constantly saw him, blazing the keyboards with an energy drink. So it's just being promoted left and right, and I think it's such a terrible combination.
I'll jump back to the sleep part first. And like when you said enough sleep, but the other key element that we tend to ignore all the time is that the quality of sleep is every bit as important as the amount. So to back up, most adults do need close to 8 hours. There's some variability and some people, but lots of people brag about how they can function well on 4 or 5 hours. Every single study that I'm aware of that's made people who are sleeping that little sleep closer to 8 hours, and you do really simple tests like look at this paragraph, cross out the word the, and how often, how accurate are you at adding up a string of numbers. These people who felt I'm functioning fine were doing poorer than when they were forced to sleep 8 hours. But the other thing, and this is how weekends screw with us, is it's not just getting your 8 hours. So if you're used to sleeping close to midnight to 8 a.m., and hey, there's a cool party or you're going to a film festival or something and you're on Saturday night, you sleep till noon, you've still got your 8 hours, but you do not wake up as refreshed or restored when you're waking up at noon. So the circadian, the consistency of sleep seems to be every bit as important. And there's some research out of my undergraduate and medical school college, University of Rochester in the last decade that identifies probably a big part of that. So for years, we didn't know what the brain's garbage system was, how it got rid of chemical and toxic waste. I mean, there's a lymphatic system in the body that drains most of the body and feeds into the venous system and gets rid of garbage. And it took them until the last decade to find what they call the glymphatic system in the brain. And the interesting thing about the lymphatic system, I mean, one is it actually involves flushing fluids through the brain, which makes connection and the space between brain cells increases. The brain cells actually shrink back. So there's less efficient brain going on that time, which is why it's happening at sleep. But it isn't just happening randomly during sleep when you shut your eyes. It's only happening during deep, slow wave sleep that's occurring during normal sleep time. So if you have deep wave sleep during a nap in the middle of the day, your lymphatic system isn't turning on. You're not flushing out those toxins. And I've oversimplified it a little bit, but again, I'm trying to make the big point. Being consistent is every bit as much as getting enough sleep in terms of quality of sleep. And I mean, not only are we promoting the monster drinks, but there's still, and it's particularly a part of sort of bro hacker culture of glorifying, oh, I'm getting by on 4 hours of sleep. Oh, I can
Right.
do this. And it's,
Yeah.
factors that's associated with developing dementia, I would say getting that good sleep is way better for you than guzzling 2 or 3 energy drinks.
Yes. And unfortunately, it's one of those things that I'll say the young and inexperienced, they don't have to go through it, but they're going through it. When you're 16, 17, even in your, you know,
So one of the
20s,
little,
you just,
uh,
you're caught
it's
up in
hard.
whatever, yeah,
Well,
whatever.
and that's part of ADHD is time discounting, is that it's harder to think of the negative consequences of your actions, and
Oh,
it's
gotcha.
much harder to see what's right in front of you. So one of the little tools or tips I use, particularly with sleep, is I tell people, the next time you've pulled an all-nighter or, slept these weird hours, take a picture of yourself that next morning when you're looking hungover, when you're looking bedraggled or spaced out or whatever it is, and take a picture of you on the night after you have a good sleep day and keep them with you so the next time you're tempted to stay out late, you can see it. So when pictures are much more evocative, much more motivating, much more emotionally stirring than just telling yourself the lesson and making it personal. So it's not just a general people shouldn't do this, but you can see the effects for yourself. It doesn't work always, but it's a helpful, powerful way of reminding people of what they need to be reminded of, and they're not likely to think of in the moment that they need to think of it.
Yeah, I like that idea. I really do, because if anybody stayed up, or had a, what do you call it? Yeah, pulled an all-nighter like you're talking about the next day, you do feel a little hungover and uh yeah, it's not sometimes not a very pretty sight. Especially the older we get, your skin recovers much, much less. Let me ask you this, a little bit more I guess going down this practical road. Let's say somebody, uh, I don't know, it's just being diagnosed, they're 30, 40, 50, and they're being diagnosed with ADHD. What's the very first step they should take, not just to manage the ADHD, but maybe to, love themselves or treat themselves with some compassion? So maybe, I guess that's maybe two questions in one.
So I mean, the question highlights one thing I tell people who say, why do we even bother diagnosing this? And I'd say with ADHD and other mental health issues, it's not that different than the rest of medicine. There's 3 big reasons to make a diagnosis. One is so that you understand what's going on. If you know that your heart pain is not heart pain, it's indigestion, that's important. If it's really a heart attack, that's important to know too. If you're distracted just because you're tired, that's one thing. If you're distracted chronically because it's ADHD, if it's another. If you're distracted because you're really anxious right now about this performance, that again, knowing the label that it's accurate and fitting helps you understand what you're dealing with. Second thing, beyond understanding, is prediction. It allows you to predict what's likely to be a problem. If your distractibility right now is just from fatigue and you're planning on getting good rest, that's not a worry. If it's ADHD and you're an adult, so you're likely to be dealing with this as an ongoing issue, and even if you're ignoring it, that's one way of dealing with it. But you know it's likely to continue and it's likely to have effects in these different dimensions. And then 3 is treatment and finding treatment that's specific to that condition. So that's why we diagnose. So the getting back to your hypothetical person, I would, it's hard for me to give a general answer because my general answer would be, what are the symptoms that you're dealing with that are causing most distress or dysfunction in your life? And for some people, it might be punctuality. For some people, it might be mouthing off to the boss, even though they know they're right and the boss is wrong. But if that costs them the job, that might be a high price to pay. If it's forgetting to bring home the milk and do the other things the wife is counting on you doing each day, and she's getting annoyed and think you're being lazy. And so it's the starting point is sorting out what's going on in your life that feels most in need of fixing. and then targeting that, and that may go any number of different directions. And again, although medication may be part of it, it's almost never the full answer.
Absolutely. I can tell you there is, at least in my experience, it just came down to the point where I said, okay, these are the things I'm challenged with. You mentioned being on time. That used to be one of my biggest challenges. And so it is very disrespectful. Some people take it as a personal insult when you're 15 or 20 minutes late constantly.
Mhm.
And so, if that's one of your symptoms that you're dealing with, I just, I made a not only a personal goal not to be late, but then I looked at, okay, how can I avoid being late? Well, all right, so luckily there's some tools now that can remind you, okay, hey, your appointment is coming up, and so I have reminders in place, so I leave 30 minutes earlier than I need to, just because you never know, traffic might happen, you know, you catch a flat tire. I just rather get there early and wait versus the other
Mhm.
thing. But I want to say that took a lot of time for me to finally wrestle with and find a system that works for me, right? Because my system may not work for somebody else. You mentioned having a to-do list or writing things down. Uh, Again, I'm a big believer in doing that, having a to-do list. And if I'm in a meeting, especially if it's going to be a boring meeting, because not all
Mhm.
meetings are boring. I found that taking notes works really well for me. So I can focus on taking notes, and it kind of helps me keep engaged as to what's going on. And again, it's different for everybody, but I know you have to have that. You have to sit down with yourself and kind of make a list of the things that are hindering your life. And if it's and then figure out a system. And And to your point, medication will not solve all of those things. So if you're not used to writing things down, medication isn't going to fix that. And if you're constantly being late, medication's not going to fix that. You have to sit there and make a conscious effort to say, okay, I'm going to stop being late. And it takes time. All right, let me ask you
Yeah,
this, because let's see, you've been again in this field for 30 plus years. You've seen what works and what doesn't. Since we've been talking about things of this nature, do you have any kind of daily practices or mindsets that you found that make a big difference over time?
again, we can re-emphasize sleep or just pass on it, but that I'd say is the number one lifestyle component that if you don't have that in place, even if everything else you're working at, it's going to keep undermining you. And two, so there's a big school of talking therapy called cognitive behavioral therapy that focuses less on feelings and childhood origins, but more on what are the behaviors, what are the thoughts going on, what are the actions you're doing, and how can we regulate them and make them more healthy. And the CBT approach for ADHD, several people independently sort of came up with it, but the schedule is the center of that. And if you don't have a daily schedule, it's going to be really, and this is, I mean, this isn't just an ADHD recommendation. You go to 12 steps for a successful businessman, and having a schedule is there. It's more important for someone with ADHD because again, they're not generating it as well. And what I tell people who are clearly solidly on the ADHD spectrum, I say I mean, most people say, okay, I'm ready. I'm going to put the biggest task today on the schedule. You need to have what I call the big four on your schedule first. And the big four are sleep, eating, movement or exercise, and relaxation, me time, downtime. Because those are all essential to sustainable life. If you're not taking care of those, your life isn't going to be working well. We've talked about sleep. I'll just say one or two words about eating. I have people who have eating disorders. I have people who consciously are on restriction schedules, so they're not eating. But the only time I have people in the office who are saying, oh my God, yesterday it was 4 o'clock and I suddenly realized I hadn't eaten all day. It's like, okay, ADHD meter's going off. Some of it is probably less connection with internal body signals, interoceptive signals. Part of it is just getting distracted. Oh, I had the lunch out and or I even put it in the microwave. But when the timer went off, I was doing something else and it's been there for 4 hours now. So scheduling hunger, if you're feeling hungry, you're behind the ball. Hunger is telling you you're already operating at a deficit. We don't
Right,
eat in society because we're hungry. We eat to prevent hunger. So having sleep, having meals, physical activity. So some bouts of rigorous activity every week is essential to keeping, and I call it activity rather than exercise, because even though I've run 100 marathons, so I'm a big fan of exercise, but I know lots of people aren't.
right,
Make it activity, make it fun. So not just some regular vigorous activities scheduled in there, but also breaking up. Sitting for more than 2 hours and maybe even an hour is probably not good or healthy. Even if you're really focused on this coding problem or X, Y, or Z, you should get up and get your body moving. And then the fourth time is making sure that there is some downtime, fun time, whether it's actual meditation, which I think good there's good value to that beyond just the restfulness of it. So, but meditation is something that's particularly difficult for many people with ADHD. But actually knowing, okay, at 4 o'clock, when work is over, I really do have an hour to play or watch my video game now, helps you focus more on the task between 2 and 4 instead of thinking, when am I ever going to get a break? When am I ever, I can't keep doing this forever. And is it ever going to happen? Oh, I should just do it now. Which but if you know, again, it takes some practice. So I recommend getting the big four in there. And then for most people, scheduling happens best as a weekly event, or usually on the weekend, mapping out what are the real important either tasks in my own life or tasks for the boss or tasks for the spouse or things I need to take care of for the kids or whatever it is, blocking those out. And I usually recommend blocks of time between 15 minutes to 2 hours. So longer than that, again, most people can't be productive. Shorter than that, you're likely to be micromanaging. An hour for many things works, but if you just need to desperately buy shoelaces, I wouldn't schedule an hour for shoelaces if the shop is right around the corner. So it's blocking out time and then it's combining your task list. And so some other things about a calendar schedule, whether it's old school day planner, pen and paper, or most people these days, it's something on their phone, it needs to be mobile. And it needs to be mobile because you might be out there and run across Bill and you want to have a social, you know, get together with him, or you might want to have, be consulting him for work or something. If you don't have your
right.
schedule, you're sort of lost and scrambling there. So it should be mobile. It should be simple to use. Um, it's good if at the end of the day you can at least glance at it so you know what you've actually accomplished. Because particularly people who are, we often, the things we haven't accomplished loom larger in our minds when we dwell on those. And the things that we've already finished, why should you think of it? It's done and gone. But that can leave a very skewed assessment overall of what we're actually getting done or not getting done in our life. So it's sort of weekly filling out the calendar and then each morning or sometimes the night before reviewing what's really important to get done today and what's would be good if I get done and what are the things left over from yesterday or others that I thought were essential and still aren't done that I have to put in today. And and again, combining the schedule with a task list where the recommendation is, yes, it might be nice to have a list of books you want to read and a list of things you need at the grocery store and to have 17 lists, but then organizing, oh, I took the grocery store list and took it when I was clothes shopping and okay, I'm gonna buy 2 pairs of carrots to wear for my daughter. No, that's not gonna work. So it's having one task list and everything doesn't have to be ranked from 1 to 213 on the list. It's sort of chunking that task list into three big components. The A group are the things that are really both urgent and important. They really have to happen today. If you have street sweeping and your car is going to get towed on Tuesday, moving the car on Tuesday has to be on that list. The B list are the things that are important, but they're less urgent. If it happens today or tomorrow, it doesn't matter. And the C list are everything else. And so often, particularly with ADHD, it's like, oh, I'm feeling I'm unproductive. I can go and buy those shoelaces today. And if you don't really need them, great, you have the shoelaces, but you didn't pay the taxes or move the car or buy the wife's anniversary present, and you're in big trouble because of that. So part of it is each day and week making sure that the urgent and important, are scheduled or get done, and then working on the B's. And then if there's time and energy, you can go on to the C's. And sometimes, the shoelaces might have been item 433, but if you've now broken both shoelaces and tied them so much that with the knots you can't retie your shoes, that one might become an A over time.
That's right. I like that. But it's true. I like to follow that system as well. And I always talk about, you're driving to one of your important appointments, and all of a sudden you get a flat tire. All of a sudden that flat tire has become urgent and important.
Yeah.
Now, eh, because again, life has changed so much, you could pull over and then grab an Uber or a Lyft and get to your appointment and then
Yeah.
worry about the car later. So all of that is you can juggle that stuff around. But I do I do believe in having the urgent, important. Usually, if you take care of those, everything else kind of just takes not necessarily takes care of itself, but it it's easier to dovetail right into your system.
That's the big issues.
Yeah, take care of the big issues. Everything else kind of, settles itself. All right. So again, I want to talk about your book real quick. I want to mention the book. It is called Recognizing Adult ADHD by Dr. John Kruse, Kruse. Um, Let me ask you this. When somebody, let's say, gets your book, they go through it. What is it that you want them to walk away with most? What ideas or thoughts, or what would you like? What's a home run if somebody walks away with your book and they're thinking X, what should that X be?
So one is and this is where you might decide to censor some of my response, but that's okay. So there's lots of very good books out there for people with ADHD, but most of them are written for people who already know they have ADHD. And my hope was to write a book that would be read by people who don't usually read mental health books or self-help books, and they would either recognize in themselves or others around them that ADHD was really having a role in their life. So the subtitle of the book is Recognizing Adult ADHD, What Donald Trump Can Teach Us About Attention Deficit Hyperactivity Disorder. And I won't go into the politics, but in terms of the 18 symptoms of ADHD, and you only need 5 as an adult robustly to make the diagnosis, he has more than a dozen of them that are unequivocal, again, not depending on whether you like his politics or not. So my naive thought is, when I was growing up, the mainstream media was fairly a shared community. If someone talked about a famous football player or a famous rock star, most people knew who they were and knew what they acted like. There was very few people, short of the president of the United States, who can say that. I know Taylor Swift's name. I don't think I'd recognize a song she wrote. I don't know if she's distracted or ditzy or organized or what she's like. So my hope was that people would be able to see his symptomatology, and that would teach people about it, that we could use this as a teaching moment. Um, and again, that he would resonate where people weren't thinking about it or in themselves or others. I mean, it turns out, and maybe with different marketing, and it still might turn out differently. He's toxic enough to many people that it turned off many people in the ADHD community who wanted to say, he's nothing like I am, even though, I mean, part of why I wrote the book was during the 2016 campaign when he and Hillary were both on the stage. My ADHD patients were saying, she's organized, she's calm, she's methodical, she's thinking before she's talking. He's blurting things out, he's pacing around the stage, he's fiddling with his hands, he's answering irrelevant questions. That's what I look like, isn't it? And they were sort of self-revelation and horrified, but that's what, this is a teaching moment.
Right.
So
No, I love it. I love it. And so, yes, the what do you call it? The complete title of the book is Recognizing ADHD: What Donald Trump Can Teach Us About Attention Deficit Hyperactivity Disorder. And I like the book jacket. I'm gonna when the guys edit this, they'll put it up here, and I'm going to put a link in the show notes so people want to check out the book. They certainly can. And John, what's the best website if somebody wants to know more about you? What's the best website for people to reach you at?
So I mean, probably my YouTube channel. So the YouTube channel is under Dr. John Kruse. I have more than 200 informational videos. One or two get into the book and the certain leader we just mentioned, but most of them are on different medications for ADHD or scheduling for ADHD. So they're informative, 15 to 30-minute videos. Um, That's a free channel. And every Tuesday at 10 o'clock West Coast time, I've been doing a question and answer session. So people who have questions can call in, write in. It's writing along the chat, and I try to answer them. And they can be ADHD or broader mental health questions or focused on the videos that I released that week. I also write on medium.com. There is a paywall there, but many of my articles are linked to that from the YouTube channel, so you can get behind the paywall for specific um, articles. And I've just finished writing, it won't be out till next year, a book tentatively called The ADHD Spectrum, which is highlighting that although the official definition is categorical, you have ADHD or you don't, what we absolutely know is ADHD exists on a spectrum of severity, and many people slip back and forth between full-blown clinical ADHD and subthreshold ADHD and conditions like head trauma or long COVID or other or new trauma can push them more firmly, or too much immersion in social media and computer technology can push people further along the spectrum, so their ADHD symptoms are more of a problem.
Yeah, I
So
love it.
that
I
will
love it.
be
So
next year.
I will, I'm going to, on the show notes, not only will I link to your book, I'll link to your YouTube channel as well. Like Dr. Cruz just said, it's got tons of great information. And then every Tuesday is a Q&A.
Every Tuesday is a Q&A. Actually,
That's pretty
next
nice.
week is the first exception in a year because there's a website part of WebMD called Attitude Magazine for ADD Attitude Magazine, and I'll be their expert webinar talking mostly about medications next Tuesday at 10 West Coast.
Gotcha.
But other than that, I'm
Well, I
there.
want to thank you so much for stopping by. This is such a neat topic, and it affects so many people. Because if you don't have ADHD, if you don't have ADHD, you probably know somebody who does, who may be affecting your life. And I think, again, putting politics aside, I think Donald Trump is a great example of what we all see with ADHD people, ADHD in adults, right? He's all over the map, and but yet he's
Well,
been fairly successful.
and that part of the last part of the book you cited emphasized the point that even if you don't, where if your leader has it, whether you like it or don't, if you don't comment on whatever position or comment he made right now, he's on to the next one. So that is instilling impulsivity, quick reaction time without thinking. We are in a culture in a time when there are a lot of feedback loops pushing all of us further along the spectrum. So
Well, thank you for stopping by. Looking forward to have you back again. Maybe next year when your next book comes out, we'll bring you back.
great.